Hello there, I'm Karl Schmid and welcome to a very special edition of Plus Talk, coming to you from Munich, Germany and AIDS 2024. We've had a phenomenal week here and spoken to really the very best in HIV and AIDS. One of those people, Meg Doherty from the World Health Organization, sat down with me to talk about where we're at in conquering HIV and AIDS. Take a look. Meg Doherty, lovely to see you again.
Very nice to see you as well.
Here we are at another AIDS conference. Why are conferences like AIDS 2024 so important?
Well, I think the first day of the conference, the pre-conference, how many people we meet, the interactions, the human element of the work that we are doing in HIV, I think that can't be said more importantly, that it's the heart of the work that we do, that at least for WHO and for many of the people who've been working in the HIV/AIDS fields for so long, it's about, serving people and ensuring people have the best quality of life. And so when we reconnect at these meetings, we hear about the science, we hear about the policies, but we also hear about what's happening in countries and what people need. And so I think that's the important piece for me when I come to these meetings, to reconnect.
We are not far away from 2030. We are all talking about it here. The targets. How confident are you that we can actually achieve them, Meg?
Well, I'm really happy to see that we have more countries that are reaching the 95, 95, 95 targets. So that's a huge push and lift. And when we look at the Sustainable Development Goals 3.3, the response to HIV is probably the most impressive. So it's been impressive. I also believe we have to do much more for the countries who have not reached those targets. And of course, we can't end AIDS as a public health threat without reaching those targets for every population in every country. So we will have more work to do. I think we're going to be very close in certain places of the world, and we'll have to keep pressing and having a very strong post-2030 agenda, especially for countries who have not done as much as those countries who've reached more closer to the 95, 95, 95 targets. We're stalling, and we need to take that stall very seriously, like we do in any other health area, and redouble our efforts and try to look exactly at why we're stalling. Where are the problems? Why do we still have too many new infections? Why do we have too many deaths? Where are these happening? And are we taking those interventions that we know what to do and how to do them and applying them in the places and for the people who need them?
What do you think WHO really needs to do more of, and how do you implement that?
I think it's a great question because, WHO as a normative agency brings forward guidelines, but it's also our responsibility to ensure that those guidelines are taken up, understood, implemented, and that's what I mean by our responsibility for doing more, is we know that the translation and the understanding and the full implementation may not be happening every place. What was that meaning for U=U messaging? Everybody needs to have access to a viral load at least once a year. People need to understand what that means, undetectable, that they will reduce its treatment as prevention, going back to what we talked about before. It's for your own health and the prevention of transmission. And what we've heard in many places, that we still have a number of serodiscordant couples and partners who are living together for years who are unaware of this message. So when I heard that, and also heard about some of the stigma that still exists for people, that's what we need to do more of. I think there is a sense in many places in the world that the problem or the crisis or the issue of HIV has been solved because we have good medicines, we have good prevention. But the other intangibles that people live with, the stigma, discrimination, and how to reduce that, and also the understanding of how medicines can also prevent transmission to others. That's what we need to do more of. And I don't think WHO alone can do that. We have to do it with partners and partnerships because there may be better people who can take our messages further.
What can you share about the WHO's guidance on policy and practices for controlling and eliminating diseases?
So WHO has several different guidelines and documents around control and elimination. One area where WHO has sort of taken the lead has been around something we call multi-disease elimination, and that's how can we look across the board at all the diseases that are either on a pathway for control, for elimination or eradication. And the example of eradication, as we all know, is smallpox. So that's something that WHO bread and butter work. But in particular, in the work that we do, we focus on the mother-to-child transmission or vertical transmission elimination. Mm-hmm. And with that, we have expanded from HIV and syphilis to HIV, syphilis, and hepatitis B. We have very strong guidance for countries, and we have now a pipeline of countries who are submitting dossiers to WHO to be validated for the elimination of vertical transmission of HIV, hepatitis B, and syphilis. This year we had the first country from Africa, Namibia, submit a full dossier. 2 years ago we had Botswana certified for elimination, for being on the path to elimination, and we now have 19 countries. Above that, we also work in the same regard for hepatitis C elimination. 2023, we certified Egypt being on the gold tier path to elimination of hepatitis C, and for STIs, well, certainly we're working primarily with syphilis right now.
Right.
Syphilis is a challenge for us, and that's something that we're bringing to this meeting and that we've been talking about, that syphilis is on the rise, and we're working very hard to get that work back on track.
Sustainability is a word I think we're going to hear a lot of over the next 5 days here at the conference. Can you talk about sustainability, monitoring, disease control, and elimination as it relates to HIV?
Yes, I think that all important words and a lot of things that everybody's talking about, probably people bring different perspectives to that. We're fully aligned with the kind of definitions that are coming out from PEPFAR, supported by UNAIDS and Global Fund, that there needs to be sustainability around the program, that we're ensuring that those programs that have been built up, people who are living with HIV, who have access to treatment, that continues, and that there's actual increase with that. You know, we can't just sustain ourselves at having 30 plus million people on treatment. We need to go further. There's also financial sustainability as well as political sustainability issues that need to be addressed. I think the idea of having greater country ownership around the financial implications and responsibilities for HIV makes a lot of sense. And I believe, you know, that the world would like to see countries who are so well capacitated, many of them with now able to, you know, manage their own programs, be in charge of their programs. And I think that that's a really, we support that. We support national strategic plans that for health that countries own, a one monitoring system, and eventually a one financial system. But it will take some time, and we believe that working country by country, it will come in different forms, and we will see slowly that countries are owning and taking more responsibility for their programs, and we hope also working with us to implement the best guidelines for everyone who needs it.
Yeah, well, going back to the new WHO guidance on policy, what do you hope the impact is, and especially with practices towards control and elimination of these diseases?
Well, I think for us, we have lots of new guidelines out. I mean,
yes, you do.
We do. This time around, we've brought a number because we are now representing both hepatitis and sexually transmitted infections. But at this meeting, we've brought forward new guidance around PEP. So how do we use pre-exposure and post-exposure prophylaxis more effectively? So PEP to PrEP. How do we use HIV self-testing in the PEP to PrEP space so that this is something that can be done more easily? How do we ensure that this can be delivered in communities? So I think having a more community-owned self-care approach to prevention is what we're bringing in. Some of our guidelines will help us with getting towards the elimination, especially the reduction of new infections. And we have other recommendations around new treatments for sexually transmitted infections and diseases. But I think we also are bringing forward a policy brief, which we hope, two of them, that we hope could be helpful around this person-centered care issue. One about how to address stigma and discrimination in the healthcare setting, and another around sort of simple practices for the healthcare worker for re-engagement of people who've fallen out of treatment care, or where treatment and care hasn't served a person, and try to bring them back into care.
And I think that ties in nicely. The theme of AIDS 2024 is putting people first. Thank you for making the time.
Thank you for having me, and have a very good conference.
You too.
Bye. Thanks.
I could sit and talk to Meg Doherty all day, and such really great information coming from her and the World Health Organization. Well, that is going to do it for this special episode of Plus Talk from AIDS 2024. Remember, you can like, follow and share Plus Life. We are across all social platforms at Plus Life Media, and you can also visit our website, pluslifemedia.com, for more information. Until next time, from Munich, Germany, Auf Wiedersehen.